Hi, my name is Dr. Dirk van der Spey and I'm an orthopedic hand surgeon practicing in the southern suburbs of Cape Town. Welcome to Cape Hand Surgery. Wrist fractures are the most common injury to the upper limb, and the most common is the distal radius fracture, typically known as the Colles fracture, when it's just involving the distal part of the radius bone and classically seen in old people. The wrist is by far the most complicated joint in the body. It is constituted of 10 bones and 3 articular surfaces and multiple interactions between tendons and ligaments running across the wrist. The spectrum of wrist fractures is really a small undisplaced crack or fracture through the distal part of the soft part of the bone called the radius, all the way through to a completely dislocated wrist with a distal radial ulnar joint involvement, TFCC tear, or scapholunate ligament tear. There's approximately up to 43% associated ligament injuries with wrist fractures, namely TFCC related injuries creating an unstable distal radial ulnar joint, as well as scapholunate ligament injuries, and therefore the topic is very wide and broad. Most wrist fractures can be treated conservatively. If it suffices the basic requirements, we can just facilitate healing through resting it for 4 to 6 weeks and then start to mobilize. This decision should be typically made by an orthopedic surgeon, and the orthopedic surgeon will guide you accordingly to the best treatment. The indication for surgery can be very difficult and there's usually many opinions on it, but the goal for surgical treatment should be to restore the normal anatomy, to restore the normal function of the hand. Once the rotation of the wrist is affected, and this is typically happens when the distal radial ulnar joint is affected, it should be considered to do a surgical open reduction and internal fixation. As mentioned previously, it is important to restore the anatomy of the wrist, and there are 3 surfaces, articular surfaces, that we should consider. We should consider the distal radial ulnar joint, the lunate fossa, which constitutes the strongest bone, as well as the scaphoid fossa. And restoring the anatomy of the distal radius might reconstruct the distal radial ulnar joint, which will then constitute the most important motion of rotation and more specifically supination. And that would be the goal for open reduction internal fixation. But when we consider surgical implications, there's a couple of things to consider, and this might help you and the surgeon to make this decision. Why do we operate? If the fracture is severely displaced or shortened, and this will have an impact on the distal radial ulnar joint, which will have an impact on your rotation. The most important part for us is to get the fracture stabilized so that you can move your hand and ultimately your wrist as quick as possible. The important thing is the goal should be right from the beginning is to restore movement, because movement is life. One of the considerations in surgery should be carpal tunnel syndrome that is associated with high energy type injuries. And typically what happens is there's bleeding in the carpal tunnel, creating a compression effect on the median nerve. In these cases, a carpal tunnel release should be done with the surgery. Of note, before we start any surgery, it must not be seen as a miracle cure and that everything will be better in 4 to 6 weeks. The timelines for wrist fractures should be seen as at least 1 year, and it can take up to 18 months for patients to really restore their normal function and mobility. So therefore, the bone will heal in 6 weeks, but the ligaments and the soft tissue envelope can take up to 3 to 6 months to heal. And stiffness will be the rule. Generally, we see flexion extension stiffness, and many patients struggle to regain full supination. But remember, the goal for surgery is to get stability of the fracture so that you can move as quick as possible. But bear in mind, there's no miracle operation that can get you back to normality within 6 weeks. There are a couple of complications with the surgery as well. There's the typical neurovascular structures that can be potentially injured in the process, but these are typically rare as we approach the radius through very safe approaches surgically. Furthermore, in open injuries, there's a high risk of infection. And then there are a couple of patients that struggle post-operatively with severe stiffness, and a devastating complication called complex regional pain syndrome, where the hand is very stiff and painful for prolonged periods of time. Therefore, knowing all these complications, we as hand surgeons endeavor from the beginning do a very safe surgical intervention, get good stable fixation, and mobilize you as quick as possible to prevent these complications. We typically use a plate for fixation that goes onto the bone, and in most cases we don't have to take it out. We can keep the plate on. In certain fractures constitute that we need to put a plate in certain positions that might irritate tendons later. In these cases we take out the plate. So in summary, wrist fractures are very common. Many can be treated conservatively, and in the case of surgical treatment, decisions should be made to operate or not, and in the case of surgical fixation, general outcomes are very good if all the correct lines cross with this correct surgical intervention and the hand therapy rehabilitation afterwards. Thanks for watching, and please feel free to visit the website at www.capehandsurgery.co.za or follow us on Instagram or Facebook.